Michael's goals encompass both short-term and long-term objectives. In the short term, they are focused on augmenting Michael's upper body strength, particularly in relation to the chest press. Significance of this goal lies in the pivotal role of upper body strength in powerlifting performance and, of course, bench press proficiency for competition. In addition to these short-term goals, Michael has a long-term objective to compete in state powerlifting competitions. This aspiration drives his dedication to training and highlights his desire to excel in the sport. Competing at the state level requires a combination of high strength, power, and technique, and mental focus, making it a challenging but rewarding endeavor. Furthermore, my client has identified the enhancement of cardiovascular fitness as a crucial goal to mitigate breathlessness during high-intensity lifting sessions. Powerlifting necessitates considerable cardiovascular demands, and improving fitness in this domain can lead to heightened endurance and accelerated recovery, thereby sustaining optimal performance during lifting sessions and allowing longer lifting sessions. Testing and outcome measures. To track my client's progress accurately, I incorporated objective assessments and closely monitored their subjective feedback. Objective measures included assessing the amount of weight lifted during each exercise session of functional powerlifting exercises, which provided tangible evidence of strength gains over time. By comparing these values to normative data for powerlifters in their age and weight category, I could gauge the client's performance compared to their peers. In addition to objective measures, I utilized subjective assessments to capture the client's perceptions and experiences. After each session, the client reported their overall feelings and any discomfort or fatigue, and during the sessions. This self-monitoring approach allowed us to adjust the program accordingly and address any potential issues promptly. By integrating both objective and subjective measures, I obtained a comprehensive understanding of the client's progress and tailored the program to their needs more effectively. Continuing with the discussion on exercise prescription, I would like to highlight specific components of Michael's training program that were informed by scientific evidence and research. As mentioned earlier, Michael is currently in the general preparation phase of powerlifting, where a combination of hypertrophy and strength-based gains are advised. The role of exercise in achieving this goal is well founded in scientific research. Work by Wisloff has demonstrated that engaging in aerobic training not only enhances cardiovascular fitness, but also expedites recovery during intense efforts. Integrating exercise such as rowing, or in our case, cycling, into my client's program can effectively elevate their cardiovascular fitness, minimizing breathlessness and optimizing performance during intense lifting sessions and leaving with less delayed onset muscle fatigue the next session. For the upper body, we place an emphasis on prioritizing upper body strength, as Michael expressed that he felt like it was his weakness. One of the key exercises we incorporated to address this goal was the barbell bench press. This traditional exercise has been extensively studied and demonstrated to significantly increase muscular growth and activate a considerable number of muscle fibers, especially when done before upper body accessory exercises. By including the bench press into his training program, we aim to enhance Michael's upper body strength, particularly in the chest, shoulders, triceps, optimizing his performance in this lift. According to the ACSM, percentiles a predicted VO2 max of 45.2 before the training program would have placed him in the 60 to 65th percentile of his age and gender group. After the program, a 47.1 has led him to the 65th to 70th percentile of aerobic VO2 max. This can show a significant change from the in-clinic training and the client's Saturday exercise bike training. These percentiles indicate the client's relative cardiovascular fitness compared to these individuals of the same age and gender. Within this fact, the increase of the bench to 110 kilos is a significant change, with the squat increasing in 10 kilos and leading him up another 5 percentiles in the bench press. Another exercises we included for upper body strength and posture improvement was the bent over dumbbell row. This exercise targets the upper back and arms and has been shown to be effective in enhancing upper body strength and promoting better posture. By incorporating the bent over double row, we aim to further develop Michael's upper body strength and enhance his bench press technique while also incorporating back strength into the exercises. Additionally, we address Michael's goal of improving grip strength, which is essential in powerlifting movements. Strengthening the grip through exercises like wrist curls can directly translate into improved performance and reduced risk of grip-related weaknesses or failure during lifts like deadlifts, bench press, and squats. By incorporating grip strength, which Michael believes was weak, into Michael's program, we aim to enhance his ability to generate force and maintain control better of the barbell throughout his powerlifting lifts. Moving on to the lower body, we included two primary compound exercises: squats and deadlifts. Squats target the quads, hamstrings, glutes, and other lower body muscle groups, and have been shown to be effective in increasing lower body mass and strength. Deadlifts, on the other hand, work the back, glutes, hamstrings, quadriceps, and core, and contribute to the overall strength development and technique improvement for optimal deadlift performance during powerlifting competitions. By including both squats and deadlifts, we aim to enhance Michael's lower body strength, muscle mass, and power. For core strengthening, we incorporated exercises such as plank and Russian twists. The plank is a simple yet effective exercise for building core stability and endurance, activating multiple core muscles in a similar fashion to most lifts done in powerlifting. Russian twists, on the other hand, work the oblique muscles and improve rotational strength and stability. By including these exercises, we aim to improve Michael's core stability, strength, and rotational power, all of which are essential in powerlifting movements. In terms of cardiovascular fitness, we incorporated the use of a stationary bike. This low impact for lower back cardio option is less stressful on the back compared to running, which is particularly beneficial for Michael, considering his mild back pain symptoms. The stationary bike was placed at the end of the session to aid in cooldown and not interfere with hypertrophy and strength gains. Research has shown that cardiorespiratory and metabolic responses during stationary bike exercises are comparable to those during treadmill exercises. By incorporating the stationary bike, we aim to improve Michael's cardiovascular fitness while minimizing the stress on his back and aiding him in exercise adherence due to his like of the stationary bike. In terms of warm-up and stretching, we included foam rolling and dynamic stretching. Foam rolling, a form of self-massage, helps to increase blood flow, reduce muscle tension, and improve mobility, making it particularly beneficial for powerlifters engaging in heavy lifting. Dynamic stretching involves moving the body for a range of motion to prepare the muscles and joints exercises, reducing the risk of injury and enhancing athletic performance. By including these in the warm-up, we aim to optimize Michael's readiness for training and reduce the risk of injury. Results of a 110 kg bench press and 150 kg squat in powerlifting are notable considering the clients achieved these feats without the use of compression tape, wraps, or belts. This demonstrates their natural strength, solid technique to prepare him for the training season. During the course of the program, I encounter situations where I need to modify and adjust the exercises to suit the client's ability and progression. In particular, there are instances when I had to regress the exercises to accommodate the client's chosen weight, taking into consideration their other training requirements. This approach followed a self-autonomy guiding style, allowing the client to have some control over their training while still targeting hypertrophy in a manner that was suitable for them. To aid this autonomy, I encouraged the client to log in their journal, their progress, and how they felt after each session, which has proven to aid positive behavior change. The combination of the self-monitoring and goal setting created a powerful feedback loop. As the client observed their progress towards their goals, it reinforced their belief in their ability to succeed, fostering a positive mindset and further enhancing exercise adherence, while giving self-autonomy and control to the client. During my reflection, I would like to address the following. Firstly, my pacing and sessions and lack of control. Upon reflecting, I acknowledge that in the earlier sessions, I may have struggled with maintaining optimal pacing. It is also important to ensure that each session is structured and organized, with appropriate timing allocated to each exercise and component. Secondly, my spotting technique. Regarding my spotting technique during the weightlifting exercises, I recognize that there may have been instances where my interventions were too intrusive. As a coach, it is crucial to provide a safe and supportive training environment for the clients. While spotting is necessary for ensuring safety during heavy lifts, it is important to find a balance. Thirdly, rapport building and motivational interviewing. I am pleased with this level. And finally, testing measures. My McArdle step test. I utilize the McArdle step test as a time-efficient and equipment-minimal testing measure for assessing cardiovascular fitness. However, upon reflecting, I acknowledge the validity of this test may have been compromised. While the test provides a quick estimation of cardiovascular fitness, it may not fully capture specific demands and adaptation associated with powerlifting, and validity is compromised heavily. In conclusion, the intervention design quality for my 31-year-old male piloting client incorporated objective and subjective assessments measures to monitor progress accurately. The exercise prescription was individualized, allowing for progression and regression.